Following a cesarean delivery, you can begin as soon as you feel comfortable with some deep diaphragmatic breathing. Placing your hands above or below the scar as is comfortable, just taking some breaths, and as you breathe in, feeling the abdominal wall expand, and as you exhale, relaxing down to baseline. As you do this, you're giving the most gentle stretch around the incision. It's safe to begin really in the first couple of weeks. Then starting around week 1 or week 2, whenever you feel comfortable, you can start with some nerve desensitization. We're using various materials and textures to massage the skin above and below, 3 or so inches above and below. I start with something really soft like a cotton ball. You can use the pads of your fingers. You can also use a washcloth or a Q-tip. And again, we're just trying to get some input into those nerves that perhaps have been damaged or are hypersensitive after the abdominal surgery. Next, you can begin with some gentle mobilization above and below the incision. So I'm massaging the skin 3 or so inches above and below, gently pulling, creating some circles, and loosening up any tension in the abdominal wall or the diaphragm. And again, this can just help to prepare for mobilization around the incision later on in your recovery. Once the incision is fully healed and there are no openings in the wound, you can start with some direct mobilization. We start gently massaging in little circles, clockwise and counterclockwise. You can pull the skin above and below the incision. You can pinch the skin together. This is a technique called indirect mobilization. And we're kind of just pinching along. You can go horizontally as well as vertically framing the incision. And again, we're doing all of this once the incision is completely healed. For most people, that's around 12 weeks. That means that the scar is both strong and can be stretched without risk of tearing. And then finally, I like to use cupping, and we would use just kind of our myofascial release cupping. We can use placing on the incision once you've applied some massage cream or lotion and suctioning across horizontally. Same thing as with your finger pads, you can do some little circles. You can massage along the entire abdominal wall, working on the obliques as well as the diaphragm and even below the incision. All of this can be helpful for reducing any restrictions or adhesions and helping to mobilize the tissue and the fascia that connects to the abdominal muscles as well as the abdominal and pelvic organs. The last thing you can do is create some suction and then pull up. And as you do that, again, you're just releasing any tension along the length of your incision.